My name is Gangadharan, who founded the Heritage Foundation way back in 1994 at Hyderabad. The primary purpose of starting Heritage Foundation was to very closely work with our for-profit center, Heritage Elder Care Services. So we are able to give away some money that we earn for a cause of elderly. And primary objectives that we have been able to do in the last 30 years of time were to reach out to policymakers and to research organizations, educational institutions, and to the biggest stakeholders, namely the elderly. I think we have been working with the elderly since 1994. We are quite happy with what we have been doing so far because we are able to reach out to variety of age group, people right from younger age to older people. Why Heritage Foundation was starting? The primary goal was very clear. I used to work for healthcare organizations, corporate hospitals, both in Chennai and Hyderabad. I realized when I was involved with healthcare of the people, a lot of old people were finding it difficult to go back home because there's nobody to look after them when they reach home. Particularly after major surgeries like open heart surgeries or hip replacements or knee replacements, they needed a lot of time to recuperate. When they went back home, both the adult children were going for offices and grandchildren were going to school. There was nobody to look after. At that point of time in 90s, there was nothing called home care services or people to come and help you. So we started Heritage Medical Center as an hospital for elderly. And since then we have been doing a lot of work reaching out. But primarily one of our focus in 95, 97 was to educate and create public awareness about what is old age. The population in India, it is expected to grow at a rate of 55-56% during the 50-year period from 2000 to 2050, according to the UNFPA. Whereas the population over 60 is expected to go 300 plus percentage. And 80 years and above is going at the rate of 700 plus. So the number of population who are going to depend on society in addition to themselves is going to be very, very huge. And we are not talking about poor and rich because we are focusing on elderly as a community. So one of the biggest areas we have been doing was to focus with the government of Tamil Nadu, government of Andhra Pradesh, which is now known as Andhra Pradesh and Telangana, and government of India. Right from 97, we were advocating the cause, and therefore we were in a position to greatly make our presence felt in a lot of meetings with the government of India. Ministry of Social Justice organized right from 97. I would very proudly say 1997 was the first meeting the Ministry of Social Justice asked Heritage Foundation to host before talking about the policy on aging. Over a period of time, because of our involvement in policy, we were able to reach out to the global community because aging was taking in a bigger way in the Western countries than Asian countries, and India in particular. India remains a younger populated country, but the numbers are going to be very, very huge. Exactly now it is 2025. In another 25 years, there will be 300 plus million old people in the country. There are going to be a lot of people who need services. While some of them would remain healthy, following the healthy aging practices, active aging practices, a lot of them are ignorant about their health and they are not even worried about their economics. When they suffer, they realize it is too late for them to know. I think one of the areas that Heritage Foundation is focusing on empowering the elderly through the community. We are reaching out to particularly the younger generation. Heritage is very happy to say that the last 15-20 years of time, right from 95, we have been talking to the college students, we have been talking to the school children, we have been hosting events in colleges and schools from 95. We host competitions for grandchildren and grandparent-grandchild get-togethers, made for each other, grandparent-grandchild, golden couple contest. All this with only one particular view, that the family should first recognize elderly are an asset. They are not a liability. I think we have been able to do this very constructively. We are very happy, particularly in Tamil Nadu, we have worked out a lot of collaboration with several universities. To begin with, we started in a big way with the Bharathidasan University in Trichy, and thereafter we reached Bharatiyar University, the Kamaraj University. So we are working with a lot of universities, and very recently we started a course, 30-hour certificate course for social work students on what is called geriatric social work, and we think this is going to make a big difference in the case of the elderly. When you're talking about elderly health care, it is normally we talk about the doctors. Understand, doctors are not going to have time to look after the old people beyond giving them medicine and treating them for diagnosed problems. Whereas others will have to take care of, other than the family, professional workers, particularly 3/4 category of people. One is doctor, second is nurse in an institutional setup, third is a social worker in the family setup or in the daycare setup, psychologist in the case of any other facility. These are the 4 categories of professional workers who can be very helpful. In addition to what is called, we train geriatric care workers across 3 or 4 states. We are keeping them available so that they are able to look after them. I think the focus is on education. Currently, we focus on 3 or 4 areas. Number 1 is we remain very strongly focused on advocacy. To ensure that we are in a position to talk to the government, we also work very closely with organizations which conduct research. One of them is UNFPA India, where we were very closely associated. Their report on building knowledge base on population aging would mention our contribution. Similarly, their annual reports, quite a few reports, would mention Heritage Foundation as a contributor. We work closely with Tata Institute of Social Sciences, Bombay. We work with the Madras School of Social Work. Currently, we are doing a research on mental health of the elderly in old age homes in Kanchipuram and in Chennai districts. I think we are reaching out to people to study and understand what's really happening to one set of people who are poor, who are vulnerable. And the other set of documentation is when we are going to the government to advocate, they're going to ask you, what is it you have done? I think this is what we are doing. And today we have brought out a book with the University of Gangadharan, a book on intergenerational solidarity. I think we are doing a lot of work on intergenerational solidarity. One of our programs is on training of trainers. We have very recently conducted a workshop for training of trainers for the NSS officers of Vizag, Andhra University at Vizag. We are going to do very soon a similar program in Bharatadasan University, covering approximately 150 colleges. What we are trying to reach out is to see that educationalists, people who are teaching, faculty members, are able to sensitize themselves on implications of aging, and therefore they are in a position to mentor college students to take care of the elderly.